Hello, welcome back to Mirror Interpretation Todorova. My name is Ioana and I am an interpreter, and here I'm giving you a series of videos, the minimum medical terminology we need to know in order to feel confident in our medical encounter. And here I'm creating video number 6 about cardiovascular system. If you want to check my other videos, click on those buttons up here, subscribe, like, share. And today again, I'm gonna talk to you about the cardiovascular system. I will show you my beautiful graphic, my beautiful painting. I remind you again, guys, painting the body part is something that will help your brain remember it, especially painting it in different colors. It's gonna make you imagine its function, imagine its magical occurring in every precise moment. So I'm gonna talk again about the problems of the cardiovascular system, and this class I will call problems related to the heart, or the most common heart problems that you're gonna encounter, I repeat, every day almost when you interpret in medical encounter. Okay guys, I will tell you honestly, some of those conditions I personally forget. I do personally forget those terms. There is always a possibility and there is always a chance you need to ask the doctor to clarify for you. I am just repassing it again for myself and for you, just to have a general knowledge, just to be ready, just to keep your brain exercised. The first heart condition, and I will give you 1, 2, 3, I believe 4, the most common heart conditions or problems that you're gonna encounter on a daily basis. The first one is called Angina Pectoris, okay? This is a very severe pain, chest, shoulder, arms, and neck problems, okay? This problem is related to not enough blood supply into the body, not enough blood supply to the heart. The chest pain, it's due to a reduced blood flow in the heart. Angina pectus, for me this is the most difficult term. Normally the symptoms are like a pressure, tightness, chest pain, discomfort, tiredness. They give some other details: neck pain, shoulder and arm pains, and so on and so on. On the body, they say you could feel dizziness, fatigue, lightheaded, heartburning, shortness of breath, then anxiety, chest pain, pressure, fast and heart rate, rapid breathing. All these things that are happening in the chest, even if it's a problem with the heart, they also affect the breathing normally. Some of the things of this angina pectoris, or a chest pain condition, they said stop smoking, exercise regularly, and a lot of doctors advise to walk. Medical, they give medicine, beta blocker, another kind of blockers, delta blocker, and so on and so on. Procedures: coronary stent, cardiovascular catheterization. I will tell you guys, the most common of this one is the stent, and also the catheterization. These two, I will tell you, I encounter pretty often when I work, so you can go ahead and go deeper into those terms. So I will say the stent and the catheterization. There is something called revascularization, which I never encountered in 5 years. Doesn't mean that they don't make it. I personally haven't worked about it. And angioplasty. There are different type of angioplasty. This is something that you're gonna encounter. I'm telling you guys, I guarantee you on a daily basis, you gotta know a little bit about that. Normally the doctor explains it, but for me, like when I hear stent, catheterization and angioplasty or something, I already know we're in cardiovascular system. And in case I have to look a term, I know very fast how to find it. Okay, the congestive heart defects. Number 2, congestive heart defects. This is a defects that we are born with. These are chronic problems. What this involved, these kind of defects are something I would say kind of secondary, but you're gonna encounter those in cardiovascular interpretation, and I will tell you they're pretty often because these defects can cause to more complicated problematics in a human body, and eventually you gonna have to interpret while the doctor explain, especially in pediatric, the problems of the children and so on and so on. So you would need to know a little bit about that. Congestive heart defects, this involved the problems with the walls of the heart, heart walls, the valves of the heart, the arteries, the veins, and all these connections, keeping the flows, valve, and so on around the heart. If there is this problems on the walls, valves, arteries, veins near the heart, this small chronic problem can create a blockage of the blood flow that goes to the heart, of course. And so if the blood flow goes slow or the blood can go to the wrong place, or there could be a blockages. The treatments can be medicines, some kind of a catheter procedure, surgery, or even a heart transplant. Talking about a heart transplant, guys, I will tell you a catheter procedure is something you're gonna encounter very often. Open heart surgery as well, and a heart transplant, especially in advanced age. So I advise you, just for yourself, go ahead, look those terms and try to understand them on the target language. If you're Spanish interpreter, on the Spanish language. Because for me, most challenging is to interpret not from English, because I use English in every language I speak, but from English versus the other language, because we speak English every day and it's so easy, I believe. But versus other language, even versus my native Bulgarian language, for me it's more difficult to find these terminologies, because I don't use them as much as I use English. I use 5 languages, and I repeat, always find these terms on the target language. Congestive heart failure. The congestive heart failure is something that scares people a lot. This is very common condition, guys. This means that the heart does not pump the blood as well as it's supposed to be. The heart failure doesn't mean that the heart stopped, because if the heart stopped, this means you're dead. It's called clinical death. So the congestive heart failure is that when the body or your pump, called heart, doesn't pump that way that it's supposed to be. There could be many conditions and many reasons for that. I'm repassing this terminology just briefly, guys. Symptoms: chest pain, coughing, dizziness, fatigue, no appetite, difficulty breathing, shortness of breath. When this condition is really severe, we can have a swallow feet, swallow legs, uh, gaining weight and retention of the fluids. This is something very common. The doctor often in their questionnaire will ask those questions. That's why interpreting precisely is so important, guys, because even a simple question, have you gained weight, could have such a serious impact on somebody's like final doctor test results and so on and so on. So if the body retain fluids, liquids, this create swallow, leg, ankles, and so on and so on. Some consequences of the heart failure, partial, or it's normally partial because it could be in a different places, in a different areas, and so on. There could be some artery disease, partial heart blockages, and so on, high blood pressure, diabetes. All these things normally are related. If you have a diabetes, this affect the heart system. If you have high blood pressure, could affect the work of the heart, and so on and so on. Just briefly, you guys have idea. Myocardial infarction. Okay, this is one of the terms that I always confuse. I haven't learned yet the difference between infarct and insult. Maybe some of you can tell me that, or maybe it's the same word for the same thing but different words. I'm not sure about it. Also called heart attack. Okay, so again, heart attack does not mean that the heart completely stopped. I repeat, guys, if the heart stops, it's a clinical death. There is a certain period of time in which you can bring back to life. This is a very short period of time. I remember when I was taking a lifeguard classes, it was 3 minutes of non-functioning. That was, I was trained. I don't know if there is some researches that change, but after 1 minute of oxygen, there is a body damage, brain damage, 2 minutes. After the third minutes, literally after the heart rate, it's very difficult to turn back a person from a drowning into life, because when we stop the oxygen and the blood flow, there is a lot of damages happening in the organs. So all these problems, again, I repeat, the heart attack, they are all temporary shocks of the organ dysfunctions, right? That again, because of the not flowing of the blood and the oxygen, create damage of the organs. So this is one of the most serious and the most common thing. And normally when somebody does have a heart attack, you will not interpret for them, and I will tell you why. Because they are not conscious and they cannot speak. But their relatives eventually will explain the symptoms, and you're gonna have to fill a questionnaire about what happened while the doctors are trying to bring this person to life, if it's like a really serious case. So a heart attack or myocardial infarction, that's when a blood clot go into the veins or into the arteries that are around the heart and block the flow. So when the flow is blocked, there is many things that happen into the body, into the organs, but because there is no nutrients carried, no oxygen carried through the blood, there is no supply of this life necessary cells or nutrients or oxygen to these organs, this damage them. So they partially can die. There could be a partial problem with your liver, with your kidneys, and so on and so on. I call it partially die, but they're partially dysfunctional because they get damaged through the lack of the necessary things to keep them functioning properly. So when we have a blood clot in one of these arteries that are around the heart, this could cause, as I said, a serious complications. So it's very important to know the symptoms because this is very serious problem, and if somebody has it, immediately call 911. The chest discomfort, a pressure squeezing, and a severe pain. I repeat again, this is very serious matter, guys. If somebody have these symptoms around you, do not hesitate to call the emergency. Shortness of breath and discomfort. There could be a discomfort on the arms, shoulders, neck, back. Normally, they said that often and sadly, I had a friend who had this problem. The most, also with the brain blockages, strokes, which is similar to the myocardial infarction, but is the blockage on the main arteries that going to the brain. There is a paralytic effect, or immediately there's few things that these people have as a result that you could see. First of all, they're really white or blank. They have this nauseous feeling. Some of them are dizzy, lightheaded. Of course, you cannot see if they're swelling on the arm, or you cannot diagnose it probably, but they're, especially with the strokes, you could see a confusion, a visible confusion. You could even hear it. A few days ago, I interpreted for a gentleman, and he was starting to talk like a child while he was having a doctor visit. And I immediately addressed the matter with the doctor, and I explained, this is the interpreter speaking. The patient in front of you, sir, is not connecting well the phrases. The patient speak like a child. He is a little bit off the connection. Of course, for the first minute or so, I did not relate that. But after 1 minute, I immediately said that to the doctor in order to let him know. Because, guys, as medical interpreter, your most important goal is to transform or transfer the meaning. And the meaning is not only what the patient says. Yes, there is some people that are thinking, they're aha, they're he. But if the person speaks in a certain way for 15 minutes and they suddenly start to be confused, lost, and their speech change, this is a sign of a stroke, or this is a sign of a serious matter. So just remember, talking about, let's go back to the heart attack. If the person have nausea, dizziness, lightheaded, or any kind of a speech difficulties, or even like difficulties seeing. A lot of people are not sure exactly what is happening to them because there is not such a thing as I have experienced in heart attacks. So for every person, it's a little bit different, guys. But just remember, while you're working, sometimes even on the phone, you could hear it, you could notice that. The doctor would never know if, as an interpreter, you don't make sure that you give that extra clarification. All right. So when the heart attack, when we have a blockage on the artery, there is not enough supply of blood and oxygen to the heart. That immediately goes to arrhythmia, tachycardia, people can faint it, and so on and so on. But basically, that's more or less what a heart attack is. That's more or less the symptoms, guys. I just like to use this video to remind again, make sure to interpret not only the words, but the meaning. It's very important. If you notice that there is some kind of a strange change, to report it to the doctor. Interpreter speaking. I repeat again, a few days ago I was interpreting and the patient had stroke while I was working. Yes, and I recognized it on the phone. And the doctor did call 911. So make sure, guys, you stay aware, you stay awake, you stay focused when you interpret. And sometimes the smallest symptoms, as a blurry vision or I see white or something, could mean such an important thing for a doctor, for somebody's health. So the doctor realized that the person was having a stroke because the person had a few symptoms with the speech and also with the vision, and we call emergency line, and I hope this person is feeling better today. But that was everything from me. I hope you guys had a wonderful reminder class about the most common problems with the heart. I'm gonna repeat them: angina pectoris, which is the chest pain; congestive heart disease, the disease we're born with, or some kind of a defect on the walls, vein, and arteries around the heart; congestive heart failure, when there is not enough pumping of the blood; and the heart attack, when there is a blockage on the veins or arteries that supply oxygen and blood flow to the heart. That was our little class number 6. I hope you enjoy it. Please share, please press like, subscribe, comment. Thank you for being here. I hope you have a wonderful day and take care. Bye-bye.